Dr. Langer, how do you get a diagnosis of chronic fatigue? How do you know it's not something like hypoglycemia or hypothyroid?
Well, that's a two-part question.
Okay.
A diagnosis of chronic fatigue basically is made by the person who is making the complaint, who has the symptom. They say that they're tired all the time. The diagnosis is presented to you. They're chronically tired. I certainly don't try and argue with the person that they're not that they're not tired. Right. I mean, they are tired. But again, you got to break down chronic fatigue into its different components. Number one, most episodes of chronic fatigue are not chronic fatigue syndrome, which is a very well-defined syndrome that the Centers for Disease Control has delineated, which includes being bone-chilled fatigue for more than 6 months, for having swollen glands, for having sore throats, and a variety of other things. And you have to have like 3 out of 6 symptoms to make the diagnosis.
Okay.
However, most family doctors really are not set up to go into depth for a workup of chronic fatigue. So if a person comes into their office, they get the routine set of blood tests, and they all seem to be okay. They'll either tell a person that it's all in their head, send them to a psychiatrist to get put on a psychotropic medication, i.e. an antidepressant.
So it's interpreted as depression.
As interpreted as depression, or which is bad, because a person can be depressed because they're sick and tired of feeling sick and tired, which is very often the case, and it is not a primary cause of, it's not a primary depression. I know I'm going all over the place here, but this is really important for people to understand that if they go to a doctor and complain of depression, but their depression is really caused by the fact that they're not feeling well, the doctor puts down depression. All an insurance company that's looking at their chart sees is the word depression, and they can turn them down for actual new policies because depression is down there. So you got to be really careful the way you present your symptoms. That's number one. Number two, as far as chronic fatigue goes, many doctors who can't find a ready cause for chronic fatigue and have seen the patients and, as I said, have done all the routine blood tests, will define that person as having chronic fatigue syndrome, which in 95% of the cases that I see is not the case, because chronic fatigue syndrome is a diagnosis of exclusion, which means that everything has to be ruled out before a person can be called having chronic fatigue syndrome. And again, chronic fatigue syndrome, once it's in your medical file, it's like saying that you've had cancer, or saying that you've had some other chronic problem, which sets off the red bells and the alarms at insurance companies.
So it's really detrimental as a diagnosis.
Totally detrimental, because most chronic fatigue that a person walks into a doctor's office for can be addressed by lifestyle changes, nutritional changes, and hormonal balancing, and can be controlled and can be ameliorated. And the person, in fact, does not have chronic fatigue syndrome. And if they're depressed, as I said, very often the depression is because they don't feel well and they have to perform with their kids, with their spouses, their jobs, etc. And it's impossible to keep up that kind of a schedule when you have no. For example, I mean, in a married situation, a person who's depressed has absolutely no libido. They got no sexual energy. So a married relationship, or just a coupled relationship, will suffer just by virtue of that. And just as a feedback, I mean, you're going to feel bad because your spouse may be getting turned off or doesn't understand, because, and I hear this a lot, that people go to their doctors and the spouse will say, or the partner will say, well, your doctor said everything is wrong. Maybe it has something to do with our relationship. So I mean, the implications of that kind of a subjective diagnosis can spread out all over the place. And the best thing to do is to get a complete evaluation from somebody who is nutritionally oriented and holistically oriented, so you can get to the bottom of what's actually causing the fatigue.
All right, that's great advice. Thank you, Dr. Langer.
Thank you.